Hello, ladies and gentlemen. Welcome to Medicare Update 2022. I am Dr. NIK NIKAM. This presentation has been brought to you by Health Life 360 LLC, located in Houston, Texas. Health Life 360 has been providing health and life insurance needs for more than 25 years, specializing in senior healthcare and also specializing in life insurance and other products. Here is a list of services provided by Health Life 360 LLC. We provide Medicare and Medicare Advantage plans, life insurance for all age groups, including child gifts, long-term care, annuities, group health insurance, including dental, vision, and travel, etc. Life insurance for estate planning. So let us begin with the agenda. We're going to be talking about Medicare basics, 2022 Medicare changes, Medicare supplemental plans, 2022 Medicare Advantage plans, highlights, 2022 Medicare prescription drug plans, and question answers. Of course, once you become eligible for a Medicare insurance, you are automatically enrolled into Medicare Part A if you have met certain criteria like 40 weeks of payroll tax deductions, and you will be eligible for Medicare Part B. Part B is something you have to apply on the Social Security website, which is a straightforward process, which you should be able to do it. And once you apply, you have a certain period of window, 3 months before your 65th birthday, the birthday month, and 3 months after that, it's the 7-month period during which you can enroll into Medicare Part B. Now let's look at all the various components of the what I call Medicare alphabet soup. On this side, we have what is called the traditional Medicare, which consists of Part A, which covers the hospital charges, hospice charges, or skilled nursing or long-term care services following a hospitalization. Part B covers for doctor's visits, medications given in doctor's office. It covers for outpatient procedures and for outpatient surgeries. Medigap or supplemental plan, it covers for co-pays and deductibles along with certain ancillary services like covering travel and other things. And Part D is the prescription plan. So when you get into Medicare, you're going to need a minimum of 4 insurances to meet basic needs. Part A for the hospital, Part B for the doctor's visit and outpatient procedures, Part on durable medical equipments, Part D for prescriptions, and supplemental plan to cover some of the deductibles and co-pays that are not covered by Medicare Part A, B, and maybe even Part D. So here are 4 things you need for a traditional Medicare. However, the Medicare Part C is a hybrid of all these 4 different components. The Medicare Part D combines the services provided by Part A, Part B, and also prescription plan, and some of the services that are provided by Medicare or Medigap are also covered under this plan, and that's why this is maybe more attractive to people on fixed income with limited resources, or people who want to consolidate all their expenses under one umbrella. The Medicare Part C or the Medicare Advantage plan can come with the standalone Medicare Advantage plan or along with a Medicare Advantage prescription plan, that is MAPD. And you can have a Medicare Advantage plan alone without a prescription plan, but it's always advisable to have a prescription plan. If you don't have a prescription plan, then you try to enroll later on, then you end up paying penalty for each month that you did not have a prescription plan. But as I said, if you have a MAPD which already incorporates a prescription plan, then that will cover your prescription coverage. Okay, let's take a quick look at the difference between Medicare Advantage plan, Medicare Advantage plan, and Medicare supplemental plan. The Medigap, or as the Medicare Advantage plan, the Medigap or the supplemental plan is the one that covers the co-pays and deductibles, whereas is the one that covers co-pays and deductibles, and it also covers some ancillary services, and it also helps with foreign travel or outside the states. Whereas Medicare Advantage plan is a sort of a replacement for Medicare Part A, Part B, and maybe Part D prescription plan also, and gives some coverage that is covered in the Medigap or the supplemental insurance plan. And we're going to take a quick look into those services that are provided by the Medicare Advantage plan. And we're going to look at the 2022 Medicare changes that are coming up that applies to standard Medicare or traditional Medicare and also Medicare Advantage plans. Well, first of all, the Medicare Premium is going to go up from $148 to $158 for year 2022. The rise is going to be approximately 6.7%, as we can see here, and the actual premium will be released later on during this year. Now, in addition to the increase in the monthly premium, the deductible is going to go up from $203 to $217. The hospital deductible has not been announced yet, but for 2021, the hospital deductible was $1,484. Just keep that in mind. And of course, if you are a high income earner, if your income is like $200,000 or $300,000, your Medicare Part B premium is going to have to pay an extra premium for keeping your Medicare Part B prescription, Medicare Part B plan. And as you can see, if you're making more than $500,000 in the bottom column, your Medicare premium is not going to be $158. It's going to be well over $491 and change. So that's coming up. And the Social Security annual cost of living adjustment, or COLA as it is called, is going up substantially in 2022. Just recently, they announced that the COLA is going to be 5.9%, which is the highest in the past 40 years. The only time we saw such numbers were in the 1980s, when the interest rates were like 10 to 12, 14%, when the inflation was more than 12%. That's when they had 15% increase in COLA. But there's only 1 year since then, in 2009, when they had a cost of living adjustment 5.7% in 2009, and this is the first significant rise in cost of living adjustment, which is going to be 5.9% increase compared to 2021. The increase in 2021 was 1.3% for comparison. And let's look at this. The Medicare Advantage plan provides a lot of services that are covered by Part A, Part B, and prescription plan, plus ancillary services like vision, hearing, and also travel insurances. In addition to that, it is also going to provide telehealth services. That is, you can see a doctor through the telehealth services if it's just a matter of renewing your medications, or just you have a question about certain medical conditions. They are already offered in various specialties like dermatology, psychiatry, cardiology, primary care, gynecology, and probably they're going to add more and more services as we go along. And of course, starting in 2021, Medicare Advantage plan has added renal services for patients with the end-stage renal disease who need dialysis. They can enroll in Medicare Advantage plan, which will take care of their Medicare Part A, the hospital services, Medicare Part B, the doctor services and dialysis services as an outpatient. It will take care of their prescription plan also with the MAPD plan, and provide certain services, including the services that are not provided by the traditional Medicare, Medicaid plans. They also assist with costs if you are on a low income budget. The Medicare Advantage plan premiums are supposed to go down. This is the only thing that is going down in 2022. It is supposed to be going down by like an average of $21, and that is primarily because of the extreme degree of competition that is in the market for Medicare Advantage plans. Let us look at the cost of insulin. In 2021, President Trump brought about a moratorium on the cost of insulin for diabetes patients, and that has been the greatest benefit to patients with diabetes, and their insulin costs have been capped to like $35 across the board, so their overall cost is like 1/3 of what it used to be in the past, and I'm going to show you a slide about that. Now let's switch gears and talk about how do you enroll into Medicare Advantage plan. There are various periods during which you can enroll into a Medicare Advantage plan. You can enroll into a Medicare Advantage plan during an annual election period, which is the most common period. Then we have special election period. If you change your job from an employer to a private Medicare insurance, or if you move to a different location, or if your plan is not serving your area, those are the area times when you can switch over to a different plan. And during Medicare open enrollment, you may be able to switch from a Medicare Advantage plan to a different one, or to the traditional Medicare. Now, the annual enrollment period is from October 15th to December 7th. That's the time when, if you are in a traditional Medicare and you want to switch over to a Medicare Advantage plan and a prescription plan, this is the time to talk to your knowledgeable Medicare Advantage plan insurance agent or a broker, so that that person can help you choose the most appropriate plan based upon your drugs, your hospitalizations, your doctors, and your specialists, and your special medical needs. When all this information is put together, then the agent is going to look at various options that are available in your area and see which one has the best service, which one has the best coverage, and which one has the best cost savings. So it is important for you to consult with your agent every year, so that you first get the updated information for the upcoming year, and you look at the new plans that may provide you new services that you didn't have to begin with in the past year. The changes that we can do during this annual election period include change from one original Medicare plan to a Medicare Advantage plan, return to original Medicare plan from a Medicare Advantage plan, switch from one Medicare Advantage plan to another one, add Part D or cancel Part D, and all these changes take effect on January 1st. Now let's talk about Medicare open enrollment, which is from January 1st to March 31st. That's when you can enroll into a traditional Medicare plan. But at the same time, if you have a Medicare Advantage plan and you want to switch over to a Medicare plan, this is the time to look into that. So in that way, if during this Medicare Advantage open enrollment period, one-time change options from a current Medicare Advantage plan, you can switch to a new Medicare Advantage plan. Or you can change from a current Medicare Advantage plan to original traditional Medicare, Part A, B, and the other things we talked about. During open enrollment period, that's between January 1st and March 31st, this is a summary of what you can do. You can switch from one Medicare Advantage plan to a different one. You can return to the original Medicare from Medicare Advantage plan, add a standalone prescription plan, or if you have a supplemental insurance, you cannot change to a Medicare Advantage prescription plan. That's one thing you need to keep in mind. Okay, why do we want to change an existing Medicare, traditional Medicare, or a Medicare Advantage plan to something different? There are a lot of reasons why we may want to change this to a different plan altogether, or switch within the groups. For example, the medication coverage might have changed. Your doctors may not be any longer on your panel of physicians. The hospital coverage may be dropped by your insurance company, or the insurance company drops the whole policy altogether, or you move to a new location where your policy is not covering you. And these are all some of the reasons why you want to change your plan. Or there may be a better plan with a better coverage and a better cost savings, and that's another reason why you may want to look into changing your plan. That brings us to the very important topic of reviewing your existing policy with your agent, looking at new changes that are coming up, looking at what new programs are available, and see which product or service best suits your need for the coming year or the year afterwards, so that you stay abreast of what is happening in the Medicare and Medicare Advantage arena. And we're going to look at some of these Medicare Advantage plans. Here, practically every major insurance company like United Healthcare, Aetna, Humana, Cigna, you name it, they all have Medicare Advantage plans. They are very similar in many respects because they are governed by the CMS guidelines. And they may have some ancillary services which are different from one insurance company to another. The premiums may vary to a certain degree, but not substantially among different plans. Of course, the premium is going to be minimal if you get an HMO, whereas if you get a PPO and a Cadillac prescription plan, it's probably going to cost you more. While talking about all these different plans, let's see what other plans are available. We have the traditional HMO, which is, you have a gatekeeper, you need referrals for seeing all the specialists. You can only see the doctors in the network, or you have a substantial penalty, and you can only go to the hospitals in the network. That's the HMO. Then we have the point of service, where you can have the doctors outside the network, but of course the costs are going to be more. Whereas PPO is a group of network of doctors and specialists where you can go and see them, but you don't need a referral from your primary doctor. The most expensive one will be the PFFS, where you have a fee-for-service arrangement. If the doctor takes the insurance company that you have, then you are okay to see that doctor even if he's not in the network. So there are various different varieties of Advantage plans available. You need to discuss with your agent, depending upon your finances and drugs and doctors and hospitals and your medical needs, see what works best in your interest. I'm just going to run through this because we are here to educate you about Medicare Advantage plans in general, as it compares to traditional Medicare, namely Part A, Part B, and supplemental insurance and prescription plans. Okay, there are various types of Medicare Advantage plans, which some of them have extra coverage for dental, for vision, for hearing, as compared to some which may have for like gym and other ancillary services. The premiums could range from $0 to as much as couple of $100 depending upon what kind of services that you want to have. And these are all different HMO plans that are available. It may be different plans available. It may be different in your locality. So you can shop around by yourself on the internet, but it's best to talk to a consultant because it is too complex and too many variables involved in making a decision as what is in your best interests from your medical perspective. And of course, AARP, the United Healthcare, which provides the Medicare HMO, Medicare Advantage Plan HMO, point of service, and PPO plans, and you can look through them. And of course, Kelsey Care also has several different plans available. These are all available on their website. You can glance through them and you can look through what are the coverages, what are the deductibles, what are the ancillary services they are providing. So you get a general idea as what they are doing. But if you go through 5 different insurance companies, you see same things sort of repeat. But the main thing is, what hospitals do they cover? What doctors are on their list? What drugs are on their formulary? These are the things that really matter most, more than a few dollar changes in the premiums. Okay, and here is just a short list of some of the insurance companies that provide these Medicare Advantage plans. And we're going to switch gears and talk about Medigap or supplemental insurance, which goes along with the traditional Medicare, Part A, Part B, Part D prescription plan, and Part Medigap plan or the supplemental insurance covers some of the co-pays, deductibles that are not covered by traditional Part A and Part B. In addition to that, they also provide like travel services, and they may provide services when you're out of the country. but they are going to be pretty limited as to what they cover. The best part is they cover your Medicare Part A deductible, hospital deductible, and Part B copays. So these are all important. The F and G are called the Cadillac plans because they cover most of the expenses that you may incur that are not covered by Medicare Part A and Part B. And along with that, Plan F also covers the Part B annual deductible, $217, which I talked about, whereas the Plan G doesn't include that Part B deductible. That's the main difference. And the other ones, you can just look through and see what they cover. And based upon your income and your needs, your insurance agent can see what works best for you. And here is a list of different insurance companies with little premium differences. And we can always compare your existing plan with a similar Medicare Advantage plan or a traditional Medicare and see how things work best for you, because there are so many different things that have to be taken into consideration depending upon your finances, your drugs, your doctors, hospitals, and the locality you are in. Now we talk about prescription plans. Prescription plans are a totally separate entity. It applies to Medicare, traditional Medicare, and also to Medicare Advantage plan. In the traditional Medicare plan, if you have Part A and Part B, you're required to have Part D, the prescription plan. Otherwise, if you start later, you end up paying a penalty. And the same thing applies with the Medicare Advantage plans. If you get a prescription plan later on, you end up paying penalty. And supplemental insurance is that covers some of the copays and deductibles. But as far as the prescription plan is concerned, all across Texas, they all have standardized rates and standardized drug coverage, which makes it easy to sort of follow. The drugs that are covered by different companies may be different depending upon their formulary. Of course, with the prescription plan, like anything else, you have the annual deductible, which is going to go up to $480 from $445 in 2021. Similarly, the initial coverage is going to go up to $4430. Then the coverage gap goes up to $7,050, and beyond $7,050, you have the catastrophic coverage kicking in. So there are a lot of minute details that have to be taken into consideration when you're selecting a standalone prescription plan or a prescription plan along with your Medicare Advantage plan. And of course, when you're looking at your drugs, there are a few other things that you have to keep in mind, that every prescription plan has its own preferred pharmacy list, and when you get the drugs there, you pay the least amount of copay or deductible copays, whereas they may also have quantity limitations as whether you can get 90-day or 30-day supplies. And also the next one is the step therapy. That is, if there's an expensive drug ordered by your doctor, the drug company, the prescription plan may require you to take the generic equivalent first, try them, and if they don't work, then they would approve the more expensive preferred drug. Coverage varies from insurance company to insurance company, and within the insurance company, depending upon the premium, these numbers change. Some of the policies may have zero copay for tier 1, tier 2, and their tier 3 coverage may be different. Tier 4 coverage may be different within an insurance company, depending upon what prescription plan you buy compared with other insurance companies. So there are a lot of things you need to compare. That's what your agent can do. Do all the shopping for you and come up with a composite idea as what works best in your interest based on your individual standing. Okay, and here's another one which is showing going from $6.20 all the way to $67. And of course, the big one doesn't have a deductible. They also cover your deductible, which is taken out of your policy. And you can look at all these differences. You can visit all these websites. You don't need to be a member. You don't need to sign up. You can look at all these different plans, different drugs coverages, and different doctors on their plan so that you get an idea. And here is like a prescription plan by WellCare. So just for example, we are showing this. We are not promoting any individual product here. This is an educational seminar, and you can look at these. And it's also an income low-income subsidies that are available from the federal government for people who have low income. If you are married and filing jointly, have an income of $25,860 or less, and their total assets are less than $30,000, you may be eligible for financial assistance for your prescription drugs. Okay, I talked about the insulin coverage, which was like $675 before Trump introduced this Part D senior savings program, and now the cost has been cut by almost 2/3 to $229 per year. And here are some prescription plans, and the Medicare prescription plan Advantage plans also cover insulin coverage in most cases, which is good news. And there are a bunch of private pharmacies that are available that can help you to meet the cost of certain drugs. Especially, they are very good, reasonable prices for generic drugs. And of course, if you go to Kroger or CVS or Walmart, or Walgreens, they all have their own prescription plans where if you sign up, you can get them for almost the same price or maybe even less. So keep these things in mind in case, but anytime you need a brand name drug, for example, Xarelto, a blood thinner used in patients who are having coronary stent, it's like $300 to $400, even with the best prescription discount options available. But if you have a prescription plan, that could be reduced to like your tier 3 or tier 4 copay. So those are the things that make a big difference, because once you get into these heart medications, diabetes medications, or cancer medications, which cost several $100s to several $1,000s per year, that's when your prescription plan will really come in handy. Okay, so ladies and gentlemen, this is a very, very rapid, quick synopsis of Medicare A, B, C, D, Medicare Advantage plan, the difference between the traditional Medicare and the Medicare Advantage plan. We talked about the supplemental insurance, which goes with the Medicare Part A and B. I talked about the prescription plan, which goes with both these two plans. And at the end of the day, I think the most important thing is for you to review your insurance policies each year in October, November, and December with your agent and see what plan you have, what coverages are covered, dropped, or not covered, and what is the next best available service or product that you may want to consider for your upcoming year. Thank you so much for watching this presentation, and please do subscribe to our YouTube channel. And here's our email address, and here are contact numbers. You can call us, and we'll be more than happy to discuss with you about your particular needs as what you need based on your requirements. Thank you so much.